So stress is going to be a common experience of most people across this pandemic. But also, I think a take-home message for today is that resilience, adaptive responding, being able to manage out of and through the acute challenges of the stresses right now, resilience is the norm, not the exception. And so as much as many people are feeling a lot of stress right now, and may be struggling, there's many ways people can kind of get their feet back under them, connect with others, help each other, connect in with other resources, and be able to move forward. And this is just a few snapshots of things that probably many of you are familiar with. A group that's making their choir virtually if they can't do it in person, ways to connect with family members, and even ways to get outside and be able to still maintain distance and practice those safe behaviors. So just to talk a little bit more, look a little bit more at what this impact might be and how it might show itself, the impact of COVID and the social distancing requirements, the economic changes, and so on. I'm just going to touch briefly on each of these 4 areas that really make up how we think and feel and manage. So first of all, looking at what reactions we might have in terms of our thinking or what's running through our heads. And worry is a big part of that, and this is what we hear from lots of people and what the surveys are telling us as well. There's lots to worry about, and if we dial back to 3 months ago, when we really didn't know how this was going to unfold in Canada, and how we didn't know much about COVID, how readily it might impact us or how at risk we might be. These were a lot of the things that were going on, and not just worried about being infected or family and friends, but just this sense many people experienced about just can't turn my brain off, talked about a COVID mental fog, so much you're trying to figure out all at once. Not just negative though, so other aspects that have come up are sort of a renewed sort of digging in, commitment to what I need to do to be able to get through this. Lots of different emotions coming up for people, and different ones at different times, probably some all at the same time. Anxiety, fear, anger, I think are some common ones, frustration, sadness. I was talking with a colleague the other day who said when she was driving by the playground and didn't see children at the playground, she was just unexpectedly caught by this sense of sadness. Now that's going to start to change, but I think we haven't paid attention to a sense of grief that has come up through this, not being able to connect with family members unless they live in the same household, they're in a different province, if there's if there's a death from the family, not being able to be there. So lots of challenges coming up with feelings, but also again, not just negative feelings, but the impact has also connected in with what we took for granted, what we're still grateful for, new appreciation for things we may not have noticed before, and a hopefulness in all of this. What about behavior changes? Well, the data tells us that, in fact, we have had some changes with a little bit more imbibing, using substances, alcohol in particular. There's a bit of a conversation about the COVID belly, people eating more or trying to support their local restaurants. So there's a change in how we're eating. Taking in a lot of information in terms of the COVID, COVID updates and so on. But even, making, people have commented on that, making errors, not being as focused, and the excessive cleaning is there. Just many people who ended up having to be at home started looking in their closets and I guess giving their place a bit of a once over because you're in those 4 walls for quite some time. And physiological, I think this was not necessarily on people's radar as much, and is a good time to step back and have a sense of how you're doing physically. But just having a constant sense of uncertainty, what's going on next, has really translated into things like even, the heart beating faster, harder time sleeping, and a lot more tension. People not even realizing that they might be holding their breath a lot of the day, clenching their fists. So all of those are common reactions that are coming up in relation to all these challenges with COVID. And I guess the question is, what does that mean, and what should I be doing about it? I'm going to be talking in a few moments about some ideas about what to do. But just wanted to flag or kind of think for a moment about, is there a point where I should be thinking about maybe taking some extra steps to connect with help, or whether it's a little bit more with peers or family, or kind of those natural supports, or whether I should be maybe connecting with some mental health resources that might be in my community. And so here are some aspects that can help you to decide if you might need to take some additional steps for care. And just we'll go through them quickly, but certainly the distress level, if it's really difficult to sleep, if you have no appetite for eating, if it's hard to just stop, you know, how you're feeling, the thoughts that are going on, and can't kind of take a break, connect with something a bit more day-to-day or usual. If it's getting in the way of your day-to-day, again, it's hard to stay, it's hard to organize yourself to be able to do something, do what you normally would. Those who have mental health history, there is a vulnerability to this being a time that can really intensify that. If you've been directly exposed to COVID or an outbreak, you know, at your workplace or in your community, that can really escalate the anxiety, and sometimes that might need a bit of extra care or attention. And certainly any significant death or loss or change at any time can really intensify how a person is managing, and where they may need some additional care or help.